Did you know that currently, there's no reliable screening test available for detecting ovarian cancer? Ovarian cancer is ranked as fifth leading cause of death among women, making it a significant concern for public health. Unfortunately, only a small portion, 20%, of ovarian cancer cases are identified at an early age, and the survival rate is quite low for those diagnosed at a later stage. Nonetheless, there is reason for optimism. When ovarian cancer is detected early, the survival rate dramatically improves to an impressive 94%. This means that the likelihood of surviving beyond 5 years following diagnosis is much higher. Researchers are actively engaged in developing improved screening methods, but for now, it's essential to recognize the symptoms of ovarian cancer as this increases your chances of overcoming it. In the upcoming video, we will explore the important signs and symptoms of ovarian cancer that all women should be aware of. But before we continue, please don't forget to like and subscribe to our channel. What is ovarian cancer? Cancer is a highly dangerous illness that can originate in a specific body part and subsequently spread throughout the entire body. Staying attentive to changes in your body can potentially aid in aiding early signs of cancer development. Ovarian cancer primarily affects women and can initiate in various regions, including the ovaries, fallopian tubes, and peritoneum. Women possess a pair of ovaries and fallopian tubes. These ovaries are situated in the pelvis, approximately in the lower abdominal area, with one on each side of the uterus. The fallopian tubes are elongated, slender structures that plays a crucial role in transporting eggs from the ovaries to the uterus. These components are vital within the female reproductive system as they contribute to the production of hormones and eggs necessary for reproduction. Now, let's delve into the symptoms of ovarian cancer as outlined by Center for Disease Control and Prevention. Number 1. Unrelated to menstruation vaginal bleeding. In postmenopausal women, if you notice unusual bleeding or abnormal discharge from your vagina, it could potentially be an indicator of ovarian cancer. Nonetheless, it's important to note that there are other conditions that could also lead to such symptoms, and this type of bleeding is not exclusively linked to ovarian cancer. According to a study, nearly 20% of women diagnosed with early-stage ovarian cancer reported experiencing vaginal bleeding. Number 2. Pelvic pain. You're familiar with the cramps that often accompany your menstrual period, right? While these cramps are usually expected, there are instances when they might signify a more serious condition such as ovarian cancer. However, it's not just limited to cramps. Feeling uncomfortable in your abdomen, hips, or lower back could potentially be an indication of ovarian cancer. As ovarian tumors grow, they can cause irritation to the tissue in your pelvic area. Unfortunately, some women might mistake this discomfort for regular period pain or digestive issues. So, if you've been attributing your abdominal pain to your diet for a significant period of time, it's important to consider the possibility that something more serious might be underlying the discomfort. Number 3. Stomach bloating. Bloating is a frequently reported issue among women, but were you aware that it could be potentially serve as an early warning sign of ovarian cancer? Prior to receiving diagnosis, numerous women might attribute their bloating to factors like aging, fluid retention, or an unbalanced diet. However, it's crucial to recognize that ovarian cancer can be responsible for causing bloating that ranges from mild to severe. In some cases, the bloating might become so prominent that you could mistakenly believe you've gained extra weight. Additionally, the growth of tumors or retention of fluids within the abdominal region can lead to an expansion of your waistline. Number 4. Often urinating. Ovarian cancer has the potential to create disruptions in urinary patterns, leading to symptoms like frequent urination. This is attributed to the close proximity of the bladder and ovaries within the body. Women who are dealing with ovarian cancer might find themselves facing an elevated urge to urinate, a sensation of burning pain while urinating, spasms in the bladder, or challenges in fully emptying their bladder. Research has revealed that around 2.5% of women diagnosed with ovarian cancer have reported experiencing a sense of urinary urgency. This symptoms was noted in approximately 16% of women seeking medical care in primary care clinics. Number 5. Changes in appetite. Experiencing a sensation of fullness after consuming a small meal or facing difficulty in eating even a small quantity of food could potentially indicate early signs of ovarian cancer. The hormone ghrelin, which originates in the stomach and stimulates appetite, plays a significant role in this context. Elevated levels of ghrelin signal to the brain that it's time to eat, prompting increased hunger. Conversely, decreased levels of ghrelin can lead to suppressed appetite. Ovarian cancer falls under the category of gynecological cancers. A study revealed that women diagnosed with gynecological cancer displayed low levels of ghrelin prior to surgery, which might have contributed to shifts in their appetite. Following surgery, their ghrelin levels rose, but they didn't experience an increased feeling of hunger. This suggests that their bodies were attempting to prevent weight loss and malnutrition. The post-surgery increase in ghrelin levels might represent a productive mechanism employed by the body to extend survival. Hence, alterations in ghrelin levels can influence appetite and potentially serve as an early indicator of ovarian cancer. In relation to ovarian cancer, the common assumption is that it's a silent disease, lacking noticeable symptoms until it advances significantly. Nevertheless, recent studies challenge this notion. Medical professionals consider the possibility of ovarian cancer if these symptoms occur more than 12 times per month and are either new or have emerged recently. Furthermore, it's important to be aware that various factors can elevate a woman's risk of developing ovarian cancer. Having a family member with ovarian cancer can elevate your own risk of developing the disease. However, ovarian cancer can also arise from mutations in your own genes, particularly genes that are closely linked to prior breast cancer diagnosis. Various factors contribute to an increased risk of ovarian cancer. Being middle-aged or older, having a history of uterine or colorectal cancer, and having an Eastern European or Ashkenazi Jewish background can all heighten your risk. Additionally, not having given birth, experiencing difficulty getting pregnant, or never having been pregnant are risk factors. Endometriosis, a medical condition characterized by tissues similar to uterine lining growing outside the uterus, often on the ovaries, fallopian tubes, or the pelvic organs, is also linked to a higher risk of ovarian cancer. Lifestyle factors plays a role as well. Being overweight, using hormone replacement therapy after menopause, smoking, having your first child after the age of 35, or never having a full-term pregnancy can increase the risk of ovarian cancer. Even fertility treatments such as vitofertilization, IVF, might raise the chance of developing a specific type of ovarian tumor. How can ovarian cancer risk be reduced? Ladies, if you're contemplating taking birth control pills, you'll be glad to know they offer more than just contraception. They can actually help lower your cancer risk too. Research indicates that using oral contraceptives for a year or more can significantly reduce the likelihood of certain types of ovarian cancer by impressive 50%. What's even better, these protective effects can persist for a decade or longer. So, in addition to their other benefits, birth control pills can be now celebrated as cancer-fighting tools for many women. However, it's important to note that while birth control pills can decrease the risk of ovarian cancer, they might also increase the risk of breast cancer. It's crucial to remember that taking measures to lower risk doesn't guarantee that cancer won't develop. A study suggests that recent use of combined oral contraceptives with the past year could lead to a 50% increased risk of breast cancer compared to those who haven't used them or stopped using them over a year ago. In any case, discussing your specific risks and concerns with your doctor is highly recommended. Breastfeeding is another noteworthy factor. According to a review, women who breastfeed experience a 30% lower risk of ovarian cancer compared to those who didn't breastfeed. Moreover, the longer the duration of breastfeeding, the longer the protective effect against ovarian cancer. If feasible, consider breastfeeding for an extended period to maximize this benefit. As the saying goes, prevention is needed better than cure. And that's it. Thank you for watching this video. Also, don't forget to like and subscribe to our channel.